And for the endocrine assessment, we're going to focus on the thyroid gland today. So trying to find the thyroid gland, we'll first kind of think about the anatomy of the throat to be able to find that thyroid gland. So we'll start with putting our fingers just below the chin, right where that muscle is. And we'll gently, slowly go down. The first structure you'll feel is that thyroid cartilage. And then continuing to go down, you should be able to start to feel the rings of the trachea, and that's where we're going to start to assess and focus. So if you could turn slightly that way, I will come behind the patient, and again with both hands I'll be feeling for that thyroid cartilage, now feeling down for the top of the trachea, those first two rings of the trachea, and flatten my hands out. And then I will ask the patient to swallow a few times just so I can see if there's any issues with that. So go ahead and swallow, and swallow one more time. Okay, and while I'm holding my hands here, I'm trying to feel if one hand may raise up farther than the other to see if there is any issues with that, and there wasn't. So now I will, from one side, gently push the gland over so I can palpate it from the other side, and then I will do it the other way as well. So pushing and palpating, pushing this side over here and palpating it over here, and no issues with that. So that was the thyroid gland assessment. We would also assess the lymph nodes. We could also take a look at the hands, see if they're sweating or there's any tremors there for the endocrine assessment.